Good afternoon. Hi. So I'm Hanni Stoklosa. I'm an emergency medicine physician at Brigham and Women's Hospital and also executive director of HEAL Trafficking, which is now in 35 countries. Is this moving with making sound? How about that? I think, yeah. So we're now in 35 countries and are comprised of over 2,600 survivors of trafficking and multidisciplinary professionals that are fighting trafficking from a public health lens. And I really resonated with a lot of what I heard from all of you in terms of motivations for being here today and for doing the advocacy work that you're doing. It was definitely my front row seat to seeing human trafficking in the emergency department that inspired me to co-found this organization and now to lead this organization. And I'm really excited to be able to talk to you about, I've never given a talk on developing expert testimony, but I've testified before Congress multiple times, so it's really nice to be able to have the opportunity to reflect on what I've learned from that process. I've testified both in hearings and briefings. I'm going to be talking about some of the differences between those two. And oh, I don't know that this is like the most updated version. Okay. Thank you. While he's getting that ready, the basic overview for this time together is this is really going to be workshopping. So I'm going to give you some context, some framework for thinking about how to go about doing an expert testimony. We're going to watch a video of an expert testimony, and then you guys are all going to practice in pairs. So you'll really get to know each other during this workshop. And so just as Dennis kicked us off in thinking about what are some of the topics that are bringing you here today, I want you to think, as I'm going through these frameworks, what topic you want to testify about to your partner. And maybe think about some questions and answers you're going to be talking about, and then maybe even potentially, if there is a current piece of legislation that's relevant to your topic, think about that. So I know that we actually have paper and pens here. Can I have someone help me just pass them out just so people can be brainstorming while I'm talking through? So this is me as like a baby testifier before Congress. So I had the opportunity and privilege to present before a hearing on a piece of legislation in 2014. That was the first time that I ever testified before Congress. And as I said, I learned a lot through that process, and each time that I've testified, I've learned a lot. So I'm excited to share those pieces with you. All right, let's get started. So the first distinction that I want to make, there are two categories at the federal level, and I'm mostly going to be speaking to the federal level. I've also testified on the state level as well. But there are these two categories of things that you might be invited to testify to before. So a hearing and then a briefing. And you can already see, based on these two pictures, there are distinctions in formality that occur in each of these. So starting off with a hearing is much more formal. So you can see kind of like the leather chairs behind me there. And the invitation comes from a committee, and usually it can either be from the minority or the majority side. And their goal is to hear a variety of perspectives from experts on a particular bill. So it's all based on some piece of legislation that's been proposed and maybe moving at varying speeds through the legislative cycle. Other points are that, so just kind of looking at where my eyes are going, I'm actually staring up at a congressman. So Congressman Pitts, who's the chairperson for that committee as I was testifying. So I'm directly speaking to congresspeople. And then behind me are the NGOs, the nonprofits, the advocates that are passionate about the issue. And that's the way the room is set up. So in this case, this was in 2014. It was specifically for HR 5411, the Trafficking Awareness Training for Healthcare Act. Do you have a question? Yeah. Were you under doing that? So for this expert testimony, I was not sworn in. So it's different that for listening to testimony around bills, they don't actually swear you in, which is interesting, which is different than a lot of the other hearings that we've been seeing before Congress, which have a different purpose. This is really just to hear sort of an array of experts' thoughts. And then in contrast, a briefing is much more informal. So you can see in this space here, it's not in one of the main hearing rooms. It's still hosted in the Capitol. I've been in rooms that are huge to ones that are really small where somebody like syncopized in the back because it was so crowded. That was fun to like step off of the panel and then go into the audience. Everyone remembers that one. But it's really a panel that's convened around a topic. So while you may have a diversity of perspectives that are there, the goal is to educate the Hill staff on a particular topic. And they can be variably attended depending on how well the advertisement for that particular briefing goes. And there still is usually a sponsoring congressperson. So in this case, this was a briefing that I moderated most recently on addressing the mental health needs of trafficking survivors. You can see in the bottom corner, Representative Benny was the one that sponsored this. And then in this case, it actually was also sponsored by a committee, but that's not always the case at the federal level. And he never showed up, so just to give you that contrast. So I really wanted him to be there. And that has been the case. I've had high-level Hill staff that will show up sometimes, depending on where they are with voting on the floor. There will be like a very brief appearance to like open up the briefing by the congressperson, but not always. And when they're there, it's hi, welcome, and then they go off to the floor and do their thing. Any questions thus far in that distinction between hearing and briefing? Okay. So this framework, I would like to thank the American Academy of Pediatrics for this framework, for thinking about how to get yourself ready to do a testimony. I discovered it as I was preparing for this, and I wish I actually had this framework. So a gift from the American Academy of Pediatrics that actually have some really great stuff on advocacy on their website. So preparation, practice, and performance. So when you're preparing your oral testimony, first of all, remember, you know so much more about this topic than your audience does, and I think it can be really scary to be in a new setting and you're before Congress, but you are the expert on this topic, and that's why they've invited you to give this testimony. It really boils down to basic communication strategies. So you want to understand the context of who you're speaking to and why you're speaking to them at that time. So you want to understand what are the motivations on both sides. What do the Congress people care about? What do the staffers care about? And you also want to know, particularly for a hearing, there's the bill, and that bill could be at any stage of gaining other co-sponsors, moving very, very quickly to, this is sort of dead in the water, and the reason they're having the hearing in the first place is try to revive it. So all of that information is going to be information that you can quickly glean from the staffers, who are usually the people that have invited you to speak. So in terms of the basic communication strategies, we all have a lot of information in our heads. We are experts on this topic, but boiling it down to one or two key messages is critical. If you want to have impact, if you want people to remember your points, you really need to boil it down to one or two key points. Personalize your message. Speak about your patient experiences and make it real for them. Tell a story. That's going to stick with them much more than any statistics. Avoid jargon, acronyms. Definitely it's good to cite data and have some statistics, but if you're just giving this kind of litany of this and that and droning on, everyone's going to tune out on you. And then typically for hearings, but I would also say this applies to briefing, you don't want to speak for longer than 4 to 5 minutes. Again, keep it simple. People will pay attention to your points much more than if you're droning on and on. If it is a hearing, which is that more formal of the two, there are actually like lights that will go on and give you time warnings, and there's a buzzer that'll go off. And you don't want to be that expert where the buzzer's gone off and you're still talking. The Congress people will not be happy with you. So you really need to be punctual as you're thinking about this and then rehearsing. And then you want to think about questions and answers, and I'll talk about that more in a little bit. So remember, you're not an island. You are an expert on this topic. Utilize the staffers who have invited you. And then, as Dennis alluded to, this is not your full-time job, and there are organizations that have thought through this and have been advocating on these topics. So use their advocacy power, use their expertise, and they can also be helpful in preparing your remarks as well. Now, in addition to the oral testimony that you're delivering in that 4 to 5 minute period of time, you usually have an opportunity to submit some sort of written testimony. And this is great for all of those factoids and all those statistics that you really want to convey, all those articles that you want to cite. At the federal hearing level, this actually becomes a permanent part of the record. So, I mean, we all have our full-time jobs, so you don't want to make it this like dissertation, but you do have an opportunity to submit some pretty substantive information in a longer format too. So if you're feeling like, oh gosh, beyond these 2 main points, I really want to be able to convey all of these things, realize that you have that opportunity, and then in the case of a hearing, it actually becomes part of the permanent record. And then you want to think, and again, this is a great thing to partner with organizations on, is there like a one-pager that you want to have available that is a take-home that can be passed out to those advocates or those other organizations that are behind you in the case of the hearing or in front of you in the case of the briefing, so that they are able to really hone in on your key messages and have those reinforced for you. And then practice. So I like to present to my cats. That's my preferred audience. But we all have our preferred audience. I would say the cats aren't as helpful because they can't give me direct feedback. My husband is also very, very helpful in practicing. And ideally, it's somebody who not only can give you honest feedback, but is not necessarily in your world and doesn't know your jargon, because they're much more likely to point out, you said that word, I have no idea what you actually meant whenever you said that. They can keep you in check on these points. And these are actually points I'm going to have as you guys pair off for you to think about as you're presenting to each other. So are you using jargon? What are the key points? Like, what actually stuck in their heads after you spoke at them for 4 minutes? How was your timing? And then how well did you integrate your personal story, including patient stories in that? Did it feel meaningful? Did the story that you shared stick with them? These are just some other points to be aware of. So for the hearing context, the ways that the parties are sitting in front of you is Democrats are on one side, Republicans on the other, and then you'll notice who the staffers are, because they're like the 20-somethings that are sitting behind and like whispering in their ears, but just to get a sense of the general setup. And then this is something that I was warned about by a staffer, the bells, but they're, and I've never actually had a hearing interrupted for this reason, but whenever there's a call to vote on the floor, you'll hear this bell go off. I don't know if any of you have met with Congress people on the Hill at all, but you'll sometimes hear these bells go off. And literally what I was warned, and again, this didn't happen to me, but that the hearing might just stop for a little while, that the Congress people will go away, and then we resume. So again, that's specific to the hearings, but just so that it's not a surprise if you encounter that. And then, you know, you could do all of this work to have your like 4 to 5 minutes of perfection that you're going to distill to the world. And then you get a question and you're like, and you end up sort of going off on a tangent. So it's really, really important in your practice stage to think through what are some of the questions that you anticipate, and have that person that you're practicing with pretend that they're, you know, the other side, coming from a completely different perspective. What motivates them and what kind of questions might come out of that? For me, related to health and trafficking, one of the controversial things might have been abortion. So that was actually something that I have practiced bullet points that I'll talk around, or practicing pivoting when something is just so far afield and you want to bring them back to your main points. So those are really critical in that practicing the questions and answers. And have that person give you critical feedback on not going on and on and on and kind of getting off topic. Again, you always want to bring them back to your 2 to 3 main points. So on the day of, arrive early, get a sense of the room. These are kind of like basic speaking things. The attire thing here should be like in your packing list side of things. It's not like you're going to like wake up and find conservative clothing like when you're in DC. Or maybe you will, but what's that? Yeah, exactly. You're in DC, so there's always Nordstrom. But it might not be open depending on the time of the year. But it is important to just kind of have, you want them to be paying attention to your words and not to your outfit. So making sure that you're kind of that blank slate for them. So wearing conservative clothing. A really great idea that AAP had was wearing a pin related to the organizations you may be representing. Again, very low key. And just use that time to review in your head the key points that you're going to be talking about. If there's any media materials, either the organization that you're working with, or you can make sure it's out on a table or that it's getting distributed so that everyone has that information. And then during your testimony, and this is something you will have already likely written out exactly what you're going to be saying, including giving your credentials. So there may be an introduction at the beginning where that's already been spoken into the room, but you just want to reinforce, I'm speaking as a physician in this capacity, and any of your titles that you feel are relevant. For the hearing setting, again, you're directing your comments to the chairperson. There's a lot of formality we're going to see in the video, but you thank this person and that person. This point of do not memorize your testimony, I think this is individual. For me, I like to have written out my entire 4 to 5 minute thing. I rehearse it, and I like to really mostly have it memorized. Some people I know talk much better off of talking points that they have written down. So whatever your style is that you've already practiced, whatever your comfort zone is, I would say stick with that. Again, remembering to be brief, personalize your response, and when it comes to the question and answer, in addition to being prepared to keep back to your points, there are sometimes questions that are posed to everyone. And so to be assertive in that setting and make sure that you're able to interject yourself whenever there's a generic question that's stated. And then don't be afraid to say, I don't know, but I'm going to get back to you and I'm going to provide you that information. After your testimony, send thank you emails. So this is part of developing relationships with that staffer. So your initial contact point may have been that invitation, but likely if that staffer is in the office for a period of time, there are going to be other health-related, maybe emergency medicine-related topics where now they know you, they like you, and so you're developing that relationship. So make sure you thank them and let them know, I'm here for you as a resource. Follow up on what you promised. Make sure the written statements get sent in. And then the other thing on that point too is that may be an opportunity. Maybe we're going to talk about social media in a bit, but that can be on a website that then is also a place for people to see what you're talking about. In addition to any video, a lot of these end up in YouTube now, whether it's on C-SPAN or not. And then follow up with media contacts. 2, 3.
Thank you, Dr. Saccharin.
Chairman Adler, Ranking Member Collins, and other members of the committee. Thank you for the opportunity to be here today to share my experience and perspectives on firearm-related injury and death in America. I'm not testifying on behalf of Johns Hopkins, but rather in my role as a trauma surgeon at Johns Hopkins Hospital, a survivor of gun violence, and a board member of the Brady campaign. I was born and raised in Fairfax, Virginia, just a stone's throw away from here. As a son of immigrants, my family was living out the American dream. And in a single instant, our lives changed. A fight broke out not far from my high school, and someone pulled out a gun and shot indiscriminately. One moment, I was a carefree 17-year-old senior, and the next collateral damage as a .38 caliber bullet was ripping through my throat and tearing into my shoulder. I spent the next month in the hospital fighting for my life. Make no mistake about it. I'm here today because of the medical professionals who treated me. The second chance inspired me to become a trauma surgeon and give other people that same second chance. As a trauma surgeon, I and my colleagues are uniquely positioned to understand and address this issue. Every day, we are the ones on the front line caring for patients who suffer injuries from bullets. We are the ones trying to stop bleeding from pulverized tissue and torn flesh. We are the ones telling families that their loved ones are never coming home. We are the ones trying to deliver data-driven solutions with inadequate research funding. And we are the ones that understand all too often that the best medical treatment from this crisis is often prevention. For many years, the debate over how we prevent firearm-related injury and death was one that members of my profession were reluctant to broach. That time has come to an end. Some of us have been told that we should stay in our lane. Well, this is our lane, and doing nothing is not an option. And if we do nothing and maintain the status quo, 1 million Americans will be shot in the next decade. Let me be clear, firearm-related injury and death in America is not only a disease, it's a true public health crisis of the United States. Every day, 109 people die from gun violence and over 240 people suffer injuries from bullet wounds. The mass shootings that we've all heard about have become too common and unfortunately capture less than 2% of the entire epidemic we face as a nation. Every day in cities like Baltimore, Philadelphia, Chicago, we have young black men that are killed, and their stories often go untold. We need to recognize this is a multifaceted health problem requiring a diverse group of stakeholders, including but not limited to healthcare professionals, public health leaders, survivors, manufacturers, academia, gun owners, and yes, the young people. We must develop a broad, multidisciplinary, multi-strategy system approach that is supported by good science and research. We have the best practices we can learn from. Look at motor vehicle crashes in the 20th century. We initially focused on the drivers. We then broadened that approach from who caused the crash to factors that led to death and injury. And we invested in research. We developed solutions like seatbelts and airbags and safer roads. And since then, we have seen fatalities per mile driven fall by 85%. This is the essence of the public health approach, a multi-sector, research-informed, evidence-based program and policies. So in response, we developed safer cars and roads, and we saved lives. The American College of Surgeons Firearm Strategy Team, a group of surgeon leaders who are firearm owners, recently published a statement describing firearm injury prevention solutions consistent with a public health approach, further underlying that as Americans, we have much more in common than we have that divides us, and there are ways to come together to prevent firearm-related injuries. Congressman Mike Thompson and Peter King introduced the Bipartisan Background Check Expansion Act, H.R. 8, on the anniversary of former Congresswoman Gabby Giffords' near-fatal injury. The bill expands Brady background checks to cover all private firearm sales, including those at gun shows or over the internet. Since the Brady law was implemented in 1994, it has blocked more than 3 million unlawful purchases. Other common sense solutions that decrease injury and death include fire injury prevention research, implementation of extreme risk protection orders, education on safe storage to end family fire, investing in safe technology, expanding access to behavioral health services, and improving victim services. We have both the opportunity and the responsibility to comprehensively address gun violence as the true public health crisis that it is. This is not a Democrat versus a Republican issue. It's a uniquely American issue, and it's uniquely in each of your hands to help fix it. The America I'm fighting for is one where parents no longer have to fear the phone call that my parents received, that the Parkland parents received, and literally hundreds of others in communities across this country are receiving every single day. As a trauma surgeon, I have to look into the eyes of these parents, and it's nothing less than heartbreaking. So the medical community implores you, the time for action is now. There's no one solution to this complex health problem, which is why we must come together as a country to build consensus and support and develop a research-informed, data-driven approach so that we can help you, as our policymakers, ensure the public safety of Americans all across this great nation. Thank you.
Awesome. So, I know. Thank you. So, focusing in on the communication style and some of what we talked about, very briefly, what did you guys notice? Say that again? He started with a narrative, and it was like very, very personal. Yep. And then he switched to the patient story as well. So he actually did both of those and integrated both of those. Good. What else?
He selected statistics that were well-funded and not too burdening.
Yep. And really powerful selective use of statistics. Good.
I think what he asked for was very specific and based on things that have already been done.
So what was his ask?
So his ask was to develop a system of research-based change that could be implemented to prevent further injury by gun violence, similar to how it's already been done.
So develop a research-based, prevention-based agenda. Yeah. Is the mic actually working? Okay. Thank you. Can you just reiterate that?
Sure, yeah. So I think what he was asking for was very specific, a research-based and prevention-oriented system of change in the gun violence kind of prevention, similar to what's already been done in the automobile industry.
Yes. Beautiful. Any other final comments, observations?
I thought he did a good job of defining terms, like explaining what he meant by a public health approach and using an analogy to something that people are more familiar with, the issue of automobile safety, to try to make it clear to people what he meant by a public health approach.
Yeah, back there. Thank you. Yeah, you made it about America, right? And that this is a bipartisan issue. Yeah. Harrison. Oh, Harrison, I thought you had.
And to swallow some of his words. He was so wrapped up in the moment and in how he both feels and thinks about this issue, which is deeply incomprehensible, that it caused him to not articulate it in the way that Congress people might understand it, especially when they were on their phones.
Yeah. Jay? So slow down and cut the end off.
To the point of bipartisanship, too, part of that was like clearly knows his audience, and that sort of thing is such like a divisive issue. It could easily be just proselytizing to people that agree with you. In his case, rather, he made it like the analogy to car accidents and motor vehicles is sort of trying to illustrate that it should be more of a bipartisan thing, and it came off in a more directed, sympathetic manner, I think, because of that.
Beautiful. Any other comments? Good or bad? All right. So we're going to practice. I just want to do a time check. Okay. Okay. So I want you to pair off with your neighbors, and you're going to do a 3 or 4 minute presentation. We're not going to have a ton of time. It's just really going to be, one of you is going to be able to go, and then we'll move on to the next presentation. But I wanted to give you the chance to, related to the issues that brought you here, to be able to speak to one other practice buddy that's not a cat, as would be my case. So I'll keep us on time. I'll be like 1 minute left, actually 2 minutes left, and then 1 minute left. So find your friend, find your buddy, and go for it.